So in response to a couple of requests I've had from students, this is a no-frills clip designed to help students determine whether they've got a reasonable grasp of the final area of study. Doesn't cover everything you need to know, but just some of the nuances in the final area of study. So can you provide a couple of distinguishing features between mental health and mental illness? Can you clearly distinguish between a discrete and dimensional approach to the classification of a mental disorder? Can you clearly distinguish between the DSM-4 and the ICD-10 in terms of categorical approaches to the classification of a mental condition? Can you point out advantages and disadvantages of the discrete approach to the classification of a mental disorder in comparison to the dimensional approach, and vice versa? Can you highlight differences and identify differences from scenarios given between the first and second axis on the DSM-4 TR multi-axial approach to the classification of a mental condition? And can you highlight key points relating to the biopsychosocial framework as an approach to the understanding of the relationship between stress and physical and mental well-being? Okay, can you clearly distinguish between eustress and distress? Can you provide examples of each? And can you point out common ground in terms of what does eustress and distress have in common? In terms of the transactional model, and geez, I've had a lot of students ask me questions on this at recent lectures I've given. So what determines whether someone is stressed or not according to this model? Are you clear on the difference between appraisal and coping? Because you need to have your head around this before you actually deal with multi-choice questions and short answer questions on this. Can you clearly distinguish between the primary and the secondary appraisal? And that is difficult. Can you clearly distinguish between emotion-based and problem-based coping, not only in terms of identification for a multi-choice question, but also in your explanation for a short answer response? And finally, allostasis. Are you clear on what this means as an umbrella concept? And are you clear on the difference between allostatic load and allostatic overload? If there's demand, I will provide solutions to this later on this week. We'll see.